We're diving deep into something really fundamental, the fascinating world where artificial intelligence meets biomechanics. It affects every single move you make.
It really does.
Yeah.
Imagine if your every step, every jump, even just reaching for something, could be, well, precisely understood, maybe optimized, and even predicted down the line.
Mhm.
That's the huge promise here.
It is. So our mission today is to unpack what biomechanics actually is, how AI is changing it, and then explore some, groundbreaking applications. Think sports, rehabilitation, clinical settings.
Absolutely.
Ah,
But we also need to look at the challenges because it's not all straightforward.
definitely. We'll cover the challenges and also look ahead at where this incredible tech is going. So let's get started. Okay, first things first. What exactly is biomechanics? People might have heard the term, but what does it mean?
Well, fundamentally, it's the science of how living things move. Think of it like applying physics to biological system, especially our bodies.
So the mechanics of the body, like why does leaning forward help you run faster?
Exactly. Or how does a pitcher generate that speed? It blends biology, physics, and engineering to study how bones, muscles, ligaments, joints all interact mechanically.
And traditionally, how did we study this? It sounds complex.
It was, and often quite labor-intensive.
Hmm.
We relied heavily on tools like motion capture mocap systems,
Yeah.
the reflective markers.
Yeah, you see athletes wearing those sometimes.
Right. And force plates embedded in the floor to measure ground reaction forces. Lots of sensors, lots of data, but analyzing it took time.
But the applications were already pretty broad, even then.
Oh, absolutely.
Yeah.
Designing better running shoes, for sure. Improving a golf swing. Helping someone recover movement after a stroke. Making workplaces safer through ergonomics, understanding physical stress, even developing more natural movements for robots. It touches a lot of areas.
Okay, so that's the baseline. Now, how is AI changing the game?
Well, the sheer volume of data generated by human movement is just immense. Think about every joint angle, muscle firing pattern, ground force, changing constantly. Humans simply can't process all that information quickly or, frankly, see all the hidden patterns.
Too much noise, maybe.
Exactly. AI, especially machine learning and deep learning, can scrutinize and handle these, well, prodigious quantities of data. It spots recurring patterns, subtle behaviors in how we move, things that would just be missed otherwise.
So it's finding signals in that noise. How does it learn these patterns?
It automates the learning process.
Hmm?
AI models are trained on movement data, and they learn the underlying relationships. This allows them to not just analyze, but sometimes even anticipate movements or potential issues. Deep learning, for example, can analyze video of someone moving and predict future performance or, crucially, injury risk.
That sounds powerful. Are there big scientific hurdles, though? Movement seems unpredictable sometimes.
That's a key challenge. AI models need to be smart enough to predict patterns in complex, full-body motion over time. They have to go account for the stochastic nature of human movement, that natural variability or randomness we all have.
Right, we don't move like robots.
Precisely. And the models also have to inspect the actual physical structure of the human body, how joints are connected and influence each other. It's a complex physics problem married to a data problem.
Makes sense. So let's talk applications. Sports and rehabilitation seem like obvious areas. How is AI changing sports performance?
It's a genuine game changer. You can track pretty much every move an athlete makes now using cameras, wearables.
So constant data streams.
Yeah, and AI crunches it fast. For instance, analyze a runner's stride literally in seconds, suggest tiny tweaks for speed or maybe injury prevention, or figure out the optimal knee angle for a harder kick in soccer.
Are teams actually using this?
Oh, definitely. Think systems like Hawkeye in tennis for line calls, but also player tracking. Or zebra technologies in the NFL mapping player movements in real time. It gives coaches a huge analytical edge. It's also used to evaluate weight training equipment performance, giving feedback right away. It really enhances training through this digitalization and intellectualization, making pose restoration more accurate too.
Pose restoration.
Yeah, like analyzing technique and helping athletes get back to their optimal form.
Okay, performance is one thing, but you mentioned injury prevention. That sounds huge.
It is. AI can spot really subtle warning signs, maybe a tiny change in gait, a slight limp you wouldn't even consciously notice that might flag a future knee injury risk.
Wow. Can it actually predict serious injuries?
The research is promising. Some machine learning models analyzing movement patterns have shown up to 80% accuracy in predicting things like ACL tears.
80%. That's significant.
It really is. And there's other tech, too. Virtual reality is being used to assess perceptual motor impairments, basically. issues in how the brain processes senses and coordinates movement. This helps develop specific interventions to cut injury risk, especially, say, in female athletes with a history of concussions.
Interesting. Any other examples?
Yeah, things like instrumented mouth guards in sports like rugby. They can detect direct head impacts and flag potentially high-risk events with pretty good accuracy, helping to identify danger zones.
That's incredible for player safety. What about the recovery side? Personalized training and rehab.
Right. Instead of generic plans, AI can look at your specific biomechanics, your stride, posture, range of motion, and help build truly custom workout or recovery programs.
Like a personal coach who knows your body's mechanics inside out?
Kinda, yeah. You're already seeing elements of this in some health and fitness apps, tailoring advice based on how you move. And in rehabilitation, it's even more powerful. AI can monitor your recovery, like how well you're walking after knee surgery, day by day.
And adjust the plan automatically.
Exactly. Adjust rehab exercises on the fly. Provides really personalized recovery plans. We saw research where AI helped analyze recovery after ACL surgery, comparing different tissue grafts. It found, for instance, that using a hamstring tendon often led to more balanced strength recovery between the quads and hamstrings.
So very specific insights.
Yes. And it's used for common things too, like managing runner's knee or iliotibial band syndrome, suggesting specific hip strengthening exercises, sometimes combined with other therapies like shockwave, based on analyzing movement patterns.
Okay, moving beyond the sports field, what about clinical biomechanics, diagnostics, for instance?
This is a critical area. AI is playing a growing role in diagnosing neurological diseases. These conditions are a huge global health burden affecting over 3 billion people worldwide back in 2021. And for many of them, early detection is just paramount.
Why is early detection so hard with traditional methods?
Well, traditional tools like EEGs, MRIs, CT scans are invaluable, of course, but they might not always catch the very earliest subtle signs, and they aren't always easy to deploy widely or frequently for screening. AI offers a different approach.
By looking at movement.
Precisely. By analyzing biomechanical data, how joints move, the rhythm and pattern of someone's walk, subtle tremors AI can potentially pick up early indicators of conditions like arthritis, Parkinson's disease, multiple sclerosis, things a human eye might miss initially.
So gait analysis becomes much more powerful.
Hugely. Traditionally, 3D motion capture in a lab is complex to analyze. AI makes processing that data faster and much more precise. This is incredibly beneficial for people with cerebral palsy, stroke survivors, or even assessing fall risk in the elderly.
Can it identify specific walking patterns linked to diseases?
Yes, quite distinct patterns. For example, Parkinson's often involves a shuffling gait with shorter strides. Multiple sclerosis might show up as increased variability in step length. Stroke survivors often have asymmetry between steps.
That's fascinating. Other examples?
Cerebellar ataxia can lead to a wide-based, unsteady gait. Huntington's disease might involve more unpredictable movements. Identifying these unique signatures helps confirm diagnoses and, really importantly, guides targeted rehabilitation.
So it links diagnosis directly to treatment planning.
Absolutely.
Yeah.
And it's not just walking. AI analyzing performance on dual tasks, like walking while doing a mental task or detecting subtle tremor patterns, is showing real promise for spotting early signs of cognitive decline, maybe even Alzheimer's, or mild cognitive impairment.
That could be revolutionary for dementia care. What about helping people after diagnosis? Rehabilitation engineering.
Yeah, this is where AI really shines too. It's powering smart prosthetics. Imagine a prosthetic leg that automatically adjusts its mechanics when you step off pavement onto grass.
So it adapts to the environment.
Exactly. Adapts to the user's movement intentions and the terrain. And AI-powered exoskeletons are another amazing area. They can learn an individual's unique movement patterns to help patients, perhaps paralyzed patients, regain some ability to walk.
Incredible potential.
It really shows how AI is fundamentally transforming neurorehabilitation, touching both diagnosis and treatment across the board.
Okay, we've painted a pretty amazing picture, but you mentioned challenges earlier. It can't all be smooth sailing. What are the main hurdles?
No, definitely not smooth sailing yet.
Hmm.
A major one is data. Getting enough high-quality, detailed biomechanical data is tough. It often requires specialized labs, expensive equipment, and it's hard to gather large, diverse data sets.
So data scarcity.
Exactly. One workaround people are exploring is synthetic data, basically. AI generating artificial movement patterns to bulk up data sets.
Does that work well?
It can help, but it's tricky. If the synthetic data isn't diverse enough or doesn't capture real-world variability accurately, it can actually introduce errors or biases into the models. Relying on small or homogeneous data sets, data mostly from one type of person, limits how well the AI performs in the real world across different people and clinics. You can see a real drop in performance on new data sometimes.
That makes sense. What about privacy? We're talking very personal movement data.
Huge concern. Wearables, cameras, AI systems are collecting incredibly sensitive information. Your gait, your heart rate patterns, how you move. Strong compliance with privacy regulations like TPCA or GDPR is absolutely essential, but also technically challenging.
And beyond privacy, ethical issues.
Yes, definitely. Algorithmic bias is a big one. If an AI model is trained mainly on data from one demographic group, say mostly men, it might not be as accurate for women or other underrepresented groups. It could unintentionally reproduce or even amplify existing societal inequalities in healthcare.
Leading to unequal diagnoses or treatment effectiveness.
Potentially, yes. Unequal diagnostic accuracy is a real risk. Then there's the black box problem. Many deep learning models are so complex, it's hard even for experts to understand exactly why they make a specific prediction or recommendation.
They work, but you don't know how.
Kind of. This lack of transparency or opacity makes it hard for clinicians to fully trust the AI's output. That's why explainable AI, or XAI, is becoming so important, developing methods to make these models more interpretable. It's crucial for clinical trust and also for meeting regulatory requirements.
Which leads to the big question. Who's responsible if the AI gets it wrong?
That's a really complex legal and ethical question. Accountability. If an AI contributes to a misdiagnosis or a bad outcome, where does the responsibility lie? With the developers,
Yeah.
the clinician who used the tool, the hospital. We're still figuring this out.
So lots to navigate there. Fairness, bias, privacy, transparency, accountability.
Exactly. And also economic disparities, ensuring these powerful tools are accessible to everyone, not just those who can afford them. And always balancing the data-driven insights with essential human clinical judgment and expertise.
Okay, despite the challenges, where is this heading? What's a future look like for AI in motion?
Well, I think real-time monitoring is going to become much more commonplace. Imagine your smartwatch not just tracking your run, but analyzing your biomechanics as you run, maybe warning you if your form is breaking down in a way that risks injury.
Continuous feedback.
Yes. And the sensors themselves are evolving, moving beyond bulky devices towards flexible, almost skin-like patches that can track movement much more subtly and comfortably. AI-driven gait analysis using things like IMUs, inertial measurement units, the sensors in your phone that know orientation and movement that's poised to become really vital, not just for diagnosis in the clinic, but for continuous remote monitoring at home.
Creating very personalized systems.
Exactly. And it points towards more holistic health management, too.
What do you mean by holistic?
I mean, AI combining biomechanical data like your gait with other health information, your heart rate, sleep patterns, maybe even diet, to get a much broader picture of your health and predict risks for things beyond just movement disorders, maybe like heart disease.
So connecting the dots across different health data streams.
Right. The emergence of AI ecosystems that integrate all this information. In the near future, you could imagine AI acting almost like a personal health coach, guiding every step, every lift in the gym, every rehab session, with real-time personalized advice based on a deep understanding of your body.
This sounds incredibly powerful, potentially transformative for personal health.
It is, but making it happen effectively and responsibly requires real interdisciplinary collaboration. You need the AI experts talking to the neurologists, the data scientists working with physical therapists, involving healthcare policymakers, everyone working together.
Makes sense. It's not just a tech problem.
Not at all. And future research really needs to focus on long-term studies, longitudinal designs, to see the real impact. We need rigorous trials, like randomized controlled trials, to prove these AI interventions actually work better. And crucially, ensuring we gather data from diverse groups across gender, age, socioeconomic backgrounds, different cultures, to make sure these systems are fair, inclusive, and benefit everyone. That's key to improving outcomes and making healthcare more efficient.
Wow. What a journey we've taken. We've really unpacked how AI isn't just, an add-on, but a truly transformative force in understanding human movement.
It really is. From fine-tuning athletic performance and predicting injuries.
To revolutionizing how we diagnose conditions in the clinic and approach rehabilitation.
It's clear this blend of human motion and artificial intelligence is fundamentally reshaping how we move, how we heal, and maybe even how we thrive.
So the final thought for our listeners, what does this all mean for us individually?
Well, as AI gets better and better at helping us understand and maybe even fine-tune every little aspect of our physical selves, How might that change things? How will our movements becoming increasingly data-driven affect our own perception of what humans are capable of? Does it change our connection, to our own bodies?
That's a deep one to ponder. Definitely food for thought. We encourage you listening to keep exploring this. Pay attention to the subtle cues your own body gives you, and consider how AI might, one day soon, play an even bigger role in your personal health journey. What stands out to you about this future of AI in motion?